Hi, my name is Alyssa, and I came to Luce with my then 5-week-old son about 2 years ago. I am a labor and delivery nurse by trade, and I've spent almost the last decade helping new moms have their babies and learn to breastfeed. And I found myself a new mom having a really difficult time feeding my baby at home. My son and I were having some latch issues, and he was taking a really long time to complete a feed, sometimes almost an hour or so, which was exhausting for both of us. And unfortunately, he was also gulping a lot of air as he was eating, which was causing intense gas pain for him. And it was just heartbreaking seeing him in so much pain every day. So I did bring it up to my pediatrician, and I feel fortunate enough that he did admit, he's like, I'm not super well versed in oral ties, but it looks like there might be something there. So he referred us here to Luce Tooth, where we met with Dr. Sheps and Dr. Luce. My husband and I were a little hesitant after doing our own research about what an oral tie release procedure involves, but the doctors here were so kind and so caring. They sat down with us. They spent lots of time kind of explaining everything that was going to happen, as well as the aftercare required at home. And ultimately, we did feel confident moving forward with the procedure, knowing that it was probably our best chance to help our son. The doctors and staff were so caring and so gentle with our brand new baby. And actually, the whole procedure only took 6 minutes. Not that I was counting or anything. But I'll never forget, they brought him back to me, and I was able to nurse him for the first time without pain. He did not seem like he was struggling. He seemed comfortable immediately after the procedure, and it just gave us so much reassurance. And then later that day, when we were home with him, it was the first time we actually saw him stick his tongue out, and he smiled at us for the first time. And we just felt so reassured that this was probably the right thing for us.